Hematology is the study of blood and its disorders. Blood is composed of 45% of cellular components and 55% of plasma, and the formation of cellular components of the blood is called hematopoiesis. Hematopoiesis resides in the medulla of the bone marrow and have ability to rise the mature cell types. The pluripotent hematopoietic stem cell CD34 is subdivided into myeloid stem cell and lymphoid stem cell. The myeloid stem cell is divided into proerythroblast, myeloblast, monoblast, and megakaryoblast in bone marrow. The proerythroblast become reticulocytes in bone marrow. The reticulocyte is immature red blood cell, and there is only 1 to 2% of reticulocytes in blood, which is replaced with the red blood cell each day. If reticulocytes count is more than 3%, it is considered as the good marrow count, and if it is less than 3%, then it is considered as the poor marrow count, which is unproduction of reticulocytes. The peripheral reticulocyte indicates increased erythropoiesis, increased reticulocytes, which is due to hemolysis, and if there is decrease in the reticulocyte, which decrease the erythropoiesis, which is due to aplastic anemia. And then they leave the bone marrow and become red blood cell in the blood. Myeloblast is subdivided into neutrophils, basophils, and eosinophils. 60 to 65% of all leukocytes in blood is neutrophils, and they become mature in 4 to 5 days. They migrate to the site of inflammation, which is chemotaxis, and then identify and then phagocytose and destroy the foreign particles. If there is increase in neutrophils by bacterial infection or tissue necrosis, then it is called neutrophilia. But if there is decrease in neutrophils, which is called neutropenia, it is caused by drug toxicity, damage to the stem cell, which decrease the white blood cell and then neutrophils, and sepsis. Sepsis is the response to a chemical when it is out of balance, and it triggers few changes in surrounding tissue. Basophils. 1% of all leukocytes is basophils. The basophilic granule contain histamine and heparin, and they are involved in production of leukotriene, and they don't have any phagocytic ability. Increasing basophil is called basophilia, and decrease is basophenia. Number 3 is eosinophils. 1 to 4% of all leukocytes is eosinophils, and they respond only against parasites. They release immunoglobulin E and migrate to the site of inflammation, and they have limited phagocytic activity. Increases eosinophilia and decreases eosinopenia. And we have monoblast. Monoblast become monocytes in blood, and their lifespan is about 10 to 20 hours in blood, and when they travel towards the tissue, they swell and enlarge in size and become tissue macrophages. In this form, they can live for months unless destroyed by phagocytic functions. And the last one is megakaryoblast, which become megakaryocytes and then platelets in blood, and they replace in blood every 10 days. Second is lymphoid stem cell, which is mainly subdivided into B lymphoblast and T lymphoblast. The B lymphoblast mature and become now B cells, and it mediates the humoral immune response. It is originated from the stem cell in the bone marrow and mature within the bone marrow, and then migrated to the peripheral lymphoid tissue, the follicle of the lymph node, and the white pulp of spleen, When antigen is encountered to the B cell, it is differentiated into plasma cell. The plasma cell produce antibodies specific to the particular antigen. They are found in bone marrow, but they do not circulate in the peripheral blood. And the T-cell mediates the cellular immune response, and they are originated from the stem cell, but they are matured in the thymus. The maturation process of thymus is present in the person having DiGeorge syndrome. The DiGeorge syndrome is an autoimmune disease in which we have deficiency of T cells because of deletion of the chromosome number 22. The chromosome number 22 provides instruction for the making of proteins. The T cell is differentiated into cytotoxic T cells CD4 and helper T cells CD8. The CD4 helps the B cell to make the antibodies and recruit and phagocytes, and CD8 directly kill the virus and infected cell. Most of the circulating lymphocytes are T cell, almost 80%. White blood cells work in two ways to prevent a disease, either by destroying it by phagocytosis or forming antibodies against it. The 6 types of white blood cell: the granulocytes, neutrophils, basophils, eosinophils, monocytes, lymphocytes, and plasma cells. The granulocytes and monocytes are formed in the bone marrow, and the lymphocytes and plasma cell, they are formed in the lymph gland, spleen, thymus, tonsil, hair patches under the epithelial cells of the gut wall. They are stored in these until they are needed.